Hello everyone, my name is Alexis Vielda and I'll be presenting my literature review on assessing ACL recovery for safe return to play. This is based off Chapter 22. This review focuses on 3 critical areas: functional testing, strength symmetry, and psychological readiness, all essential for determining when an athlete is ready to safely return to sport after ACL surgery. Introduction to ACL injuries and RTP. Anterior cruciate ligament, otherwise known as ACL. ACL injuries are common in athletes, especially in sports involving cutting, pivoting, or jumping, such as soccer, basketball, skiing, and football. Despite advancements in surgical techniques, the rate of re-injury remains high, especially within 2 years after returning to the sport. Traditional return-to-play decisions often rely on a fixed timeline such as 6 months, but these may not be sufficient to ensure an athlete's safe return. Functional testing and limb symmetry. Functional testing and limb symmetry are central to return-to-play decisions. Tests like single-leg hop tests and isokinetic strength assessments are used to evaluate recovery. However, emerging research suggests that limb symmetry alone, particularly the Limb Symmetry Index (LSI), may not be enough to guarantee readiness. In fact, some studies show that hop tests yield higher LSI values compared to more reliable measures like isokinetic tests, indicating that strength alone may not be sufficient. Psychological readiness is a critical but often underemphasized component of return to play. Confidence in knee stability and fear of re-injury can greatly influence an athlete's performance. Athletes with lower psychological readiness tend to hesitate during performance and are at a higher risk for re-injury. Unfortunately, there are no standardized psychological readiness assessments in most return-to-play protocols, which can complicate decision-making. Prehabilitation and early rehabilitation. Prehabilitation, which basically just means training before surgery, has been shown to improve post-surgical outcomes by enhancing muscle strength, neuromuscular control, and joint stability. Early rehabilitation, including open kinetic chain exercises, is also crucial in promoting strength while protecting the healing graft. However, there is a lack of consensus on the optimal prehabilitation and early rehabilitation protocols, highlighting the need for further research in this area. Achieving strength symmetry between the injured and uninjured limbs is essential, but it's not the only factor. While strength recovery is crucial, graft healing is slower and requires careful management. Overloading the graft too soon can impair recovery and stability. Exercises should focus on building strength without compromising the graft, with open kinetic chain exercises being particularly beneficial. One major challenge in ACL rehab is the lack of standardized protocols. Many rehab programs follow different methods with no universally agreed upon guidelines. This means that athletes might receive varying levels of care depending on where they are treated. Clinics use different functional and strength tests, such as hop tests versus isokinetic assessments, which can result in differing evaluations of an athlete's readiness to return to play. Rehab programs differ significantly in both the intensity and the progression of exercises. This variation can lead to different recovery speeds and outcomes among athletes. Return to play timelines also vary, with some protocols setting different criteria for when an athlete is ready to resume the sport. This inconsistency increases the risk of a premature return and potential re-injury. Key takeaways: RTP should consider physical and psychological readiness. Functional testing and strength symmetry are crucial, but they should be combined with psychological assessments. Prehab and early rehab strategies can accelerate recovery and improve long-term outcomes, and standardized RTP protocols are essential to improve care and reduce the risk of re-injury. In conclusion, ACL rehabilitation and return-to-play criteria must evolve to integrate more than just physical recovery. Psychological readiness, muscle strength, and functional testing should all play equal roles in the decision-making process. Moving forward, more research is needed to standardize return to play protocols and develop reliable tools for assessing psychological readiness. By refining this criteria, we can ensure safer and more effective returns to sport for athletes. This concludes my presentation. Thank you guys for watching.